Hey everyone, Dr. Mike here with OT Pulse. And let me tell you, nothing gets me fired up more than making sure healthcare is as safe as it can be. We've all seen it on TV, the drama of the operating room. But behind the scenes, it's all about meticulous attention to detail and unwavering commitment to safety. That's why we're diving deep into a topic that's close to my heart: environmental safety in the OR. Today, we're going to break down the essential practices that keep both patients and healthcare professionals safe. We're talking everything from patient identification to infection control, because when it comes to your well-being, there's no room for error. So scrub in and let's get started. All right, imagine this. You're prepping for surgery and there's a mix-up with patient charts. Sounds scary, right? That's why proper patient identification is non-negotiable. We're talking about more than just names here. Every single patient-related item, from blood samples to lab results, needs to be meticulously labeled and verified. And trust me, we double, even triple check. Why all the fuss? Because even a seemingly small mistake can have huge consequences. We're talking about potentially life-altering situations here. That's why we use a multi-layered approach. Think wristbands with barcodes, standardized labeling systems, and constant communication between healthcare providers. Remember, patient safety starts with accurate identification. No shortcuts. We're all in this together, and clear communication is key to making sure everything runs smoothly. Listen up, because this is crucial. The world of medicine is constantly evolving. New technologies, procedures, and guidelines emerge all the time. And as healthcare professionals, it's our duty to stay ahead of the curve. That's where continuing education comes in. Think of it as a way to constantly level up your skills and knowledge. We're talking about attending conferences, completing online modules, and undergoing rigorous training programs. And it's not just about checking boxes to maintain your certification. It's about providing the absolute best care for our patients. Because let's be real, medical knowledge can be complex and ever-changing. By staying updated on the latest research and best practices, we're ensuring that our patients receive the highest standard of care possible. It's a commitment to lifelong learning, and it's a responsibility we take very seriously. So let's keep those brains engaged and never stop striving for excellence. Moving a patient from point A to point B might seem simple, but trust me, it's a lot more intricate than it looks, especially in a fast-paced environment like the OR. We're not just talking about getting someone from the pre-op area to the operating table. We're talking about ensuring their safety and comfort every step of the way. That's why we have strict protocols in place for patient transport. We're talking about using the right equipment like specialized stretchers and wheelchairs and making sure they're properly secured. We also need to be mindful of any medical devices or attachments like IV lines or catheters. Any sudden movements or jerks can dislodge these, so we move with care and precision. And of course, communication is key. We need to clearly communicate with the patient, letting them know what we're doing and making sure they feel secure throughout the process. It's all about teamwork, folks, and making sure the patient's well-being is our top priority during every transfer. All right, let's get real for a second. The OR can be a high-risk environment. We're working with sharp instruments, flammable materials, and even radiation. But don't worry, we've got this. We have rigorous safety protocols in place to minimize those risks and keep everyone safe. Let's start with fire safety. We're talking about strictly controlling ignition sources like lasers and electrosurgical equipment. And of course, infection control is paramount. We're talking about meticulous hand hygiene, sterile techniques, and proper disposal of contaminated materials. Then there's radiation safety. We use lead aprons and shields to minimize exposure during X-rays and fluoroscopy. But it's not just about following rules blindly. It's about understanding the why behind each precaution. We want everyone in the OR to be aware of potential hazards and feel empowered to speak up if they see something that seems off. Remember, safety is everyone's responsibility. Now, let's talk about electricity. It's essential for powering our life-saving equipment, but it can also pose a serious risk if not handled properly. That's why we're obsessed with electrical safety in the OR. We're talking about regular inspections of all electrical equipment, making sure cords are intact and there's no fraying. And we never ever use faulty equipment. If something's not working right, we take it out of service immediately. No exceptions. We also make sure all equipment is properly grounded to prevent electrical shocks. And we're careful to avoid overloading circuits, which can lead to overheating and even fires. But here's the thing. Electrical safety isn't just about the equipment. It's also about us. We need to be mindful of our surroundings and avoid contact with wet surfaces when working with electrical equipment. Because when it comes to electricity, it's always better to be safe than sorry. Here's the deal. Healthcare facilities generate a lot of waste. And I'm not just talking about used tissues and empty food containers. We're talking about biomedical waste, which can be infectious, sharp, or even radioactive. That's why we take biomedical waste management incredibly seriously. We have a strict infection control policy in place to ensure that this waste is handled and disposed of properly. We're talking about different colored bins for different types of waste. Sharps go in one, infectious waste in another, and so on. And we don't just toss things in haphazardly. We make sure everything is properly bagged, labeled, and sealed to prevent leaks and contamination. This meticulous process protects not only healthcare workers, but also the environment and the public. It's all interconnected, and proper waste disposal is a crucial part of breaking the chain of infection. So, the next time you see those color-coded bins, know that they represent a vital part of keeping everyone safe. Now, let's talk about something that might seem a little less exciting than, say, open-heart surgery, but it's just as important: quality control. We're talking about keeping accurate and detailed records of everything that happens in the OR. From the anesthesia used to the instruments sterilized, it all gets documented. Why? Because this paper trail allows us to track our performance, identify areas for improvement, and ensure that we're consistently delivering the highest standard of care. We can analyze data, identify trends, and make adjustments to our protocols to enhance patient safety and outcomes. It's about constantly striving for better, even when things are going well. And let me tell you, this documentation can be a lifesaver. If there's ever a question or concern about a procedure, we can go back and review those records. It's all about accountability and transparency. Let's talk about something that might seem simple, but it's crucial for patient safety and surgical success: positioning. We're not just laying someone down on a table, we're carefully and strategically positioning their body to ensure optimal access for the surgical team while protecting their nerves, skin, and circulation. We use specialized padding and supports to prevent pressure ulcers and nerve damage, especially during lengthy procedures. And of course, we're meticulous about applying monitoring devices like EKG leads and pulse oximeters to keep a close eye on vital signs throughout the surgery. Proper patient positioning is a team effort involving surgeons, nurses, and anesthesia providers. It's about communication, collaboration, and a shared commitment to patient well-being. Because when it comes to surgery, every detail matters, and proper positioning can make all the difference. That's it for today, everyone. We've covered a lot of ground, from patient identification to biomedical waste management. And if you're still with me, give yourself a pat on the back. Remember, creating a safe environment in the OR isn't just about following rules. It's about fostering a culture of safety, where everyone feels empowered to speak up and prioritize patient well-being above all else. So, let's continue to learn, grow, and work together to make healthcare as safe as it can be. Don't forget to like, share, and subscribe for more informative content on all things healthcare. Until next time, stay safe and stay healthy.